Mature Cystic Teratomas by Laura Roback
and Emily Carrizzo.
Emera Carback, aged 27 years old, went to her gynecologist's office for her annual physical. Her doctor noticed that her uterus was the size of a grapefruit and there was an obvious palpable mass in her lower pelvic area. Her doctor asked if she was pregnant, and she answered no. Emera has been asymptomatic. What is a mature cystic teratoma? A mature cystic teratoma is the most common ovarian neoplasm and the most common germ cell tumor. It is a benign tumor that contains fatty sebaceous material, hair, and/or teeth. It is a slow-growing tumor. It is derived from 2 out of 3 layers of the ovary, but most commonly from the ectoderm. It ranges from tiny, about ½ an inch, up to 40 centimeters, filling the abdomen. It is seen in 80% of women in their reproductive years.
What are some clinical symptoms of mature cystic teratomas? They are usually asymptomatic. You can experience pelvic pain and pressure, adnexal pain, clinical palpable, abnormal uterine bleeding, and difficulty urinating.
What are some complications that can occur with this pathology? Ovarian torsion, hemorrhage, rupture of the ovary, which is rare. When it is slow-growing, other conservative treatments can be effective.
What are ultrasound appearances? The ultrasound appearances depend on germ cell layer that is involved. Cystic lesions with an echogenic tubercle projecting into the cyst lumen. Diffusely or partially echogenic mass displaying attenuation. Multiple thin echogenic bands due to hair in the cavity. Pure sebum in the cyst may be hypoechoic or anechoic, and the fluid levels result from sebum floating above aqueous fluid, appears more echogenic than the sebum layer. The dermoid plug is echogenic, with shadowing as a result of hair, tissue, or calcification.
This is an ultrasound image of the left and right ovary, the left ovary having the dermoid tumor and the right ovary being in its normal state.
This is an ultrasound image of a dermoid cyst with a complex cystic mass.
This is an ultrasound image of a dermoid tumor with Rokitansky protuberance, hair, and fat.
This is a picture of mature cystic teratoma that was surgically removed. It is filled with hair, sebaceous material, and thyroid tissue.
What are Emera's treatments and prognosis? Once the enlargement of the uterus was noticed by Emera's doctor, an ultrasound was ordered. When they saw the mass, the doctor recommended waiting through 1 menstrual cycle to see if it got any bigger. When they saw that the mass had grown, they sent her in for a surgical removal of it. They did this laparoscopically. She got it biopsied to confirm that it was a mature cystic teratoma. Once removed, Emera did not have any other problems. When it is rarely malignant, some other treatment options that a person can do are chemotherapy and radiation. They could also have a oophorectomy, or removal of the ovary, or a simple cystectomy, or removal of the dermoid without removing any other adjacent.
What are some other imaging modalities? The patient can go for CT scans, which are used to detect fat within the dermoids and suspects malignancies. The patient can also go for MRI scans, which are used to detect fat, calcifications, and locating the organ of origin. Here are the references we used for the project.